if you have a shoulder patient in your clinic, then people do get concerned, how the hell am I going to manage this and how am I going to investigate? So I have a very simple mantra. You first ask if there's pain. Obviously there's got to be pain, and if there's stiffness or not, and if there's got a neck problem. If there's associated neck problem, we always think there could be an associated neck issue as well, so we examine the neck. When examining the shoulder, you want to make sure if it's really stiff, you're thinking frozen shoulder or arthritis. But if it's a young patient, it could very much be frozen shoulder or impingement or rotator cuff tear if there's an injury. So that's really there to it. If it's a rugby player and there's an initial dislocation, please do send them to me, because some people need immediate surgery, some people need physiotherapy. So once that's done, in a clinic situation, I'm going to go through a 1-minute examination as to how this can be done for you to decide, does the patient need an x-ray? Does the patient need any further investigations? A lot of people send all the patients for ultrasound examination. Please avoid doing that. That doesn't really help the clinician so much, but can worry the patient if they see that there's a result of a 1 or 2 millimeter tear. That starts worrying them, there's something wrong, and they come seeking advice, whereas that's not a treatable option from surgery. So if there's any questions from that sort, you're always welcome to call me or the hospital and I can give an advice, but I hope that this examination will clearly tell you how to manage the shoulder. Hi, Nicole.
Hello.
So this is Nicole, and she's very kindly agreed to take me through a shoulder examination with her. Okay, so Nicole, I'm going to start with tapping you on the neck here, and that's to look at the scalene triangle to see where the nerves go down from there. Does that hurt you? Does the pain go down the arms?
Yes.
If Nicole says yes, that means there's a problem with the neck, and tapping the nerve, the brachial plexus nerve comes down there, and there possibly is a neck problem. But if I tapped again, is that hurting you now?
No.
No, so we know that shoulders, more or less the neck is clear, and we start going on to the shoulder. So start with the collarbone, press, keep going down, and you feel a little bump over here. That's the acromioclavicular joint. And if I press down there, is that painful?
Yes.
So if it's painful, means that there's a little bit of tenderness in the acromioclavicular joint, means there would be impingement below. If there's impingement below, means there could be a bit of a rotator cuff problem. So we're starting to think at this stage that possibly there's got impingement. So while I've got the finger here, then I slip that finger in front and going straight to the long head of biceps area and hold on to the elbow and rotate it like that. And if that's tender, then we know that the impingement has actually gone down to the rotator cuff into the long head of biceps, and that could be a problem. Okay? So once that bit testing is done, while I've got the arm down, I'm going to do yet another examination of just holding the arm like that and trying to give an external rotation. So that is full external rotation going up to almost 50 to 60 degrees. If I tried to pull the arm and that got stuck and is not moving, then the likelihood is that someone as young as Nicole will have frozen shoulder, or someone who's much older could be arthritis, or both. So, assuming that there's no frozen shoulder, I want to do the impingement test that we do. We call it the Hawkins impingement test. So we keep going, pull the arm up and do that. And if there's pain, is there pain? Well, there's pain. That means there's impingement because the humerus head has gone under, reduced the space and caused impingement. But if I do that again and there's no pain, there's no impingement. If there was pain, and I tell Nicole, make a fist now, don't let me push it down, and if she can't hold it and the arm falls down, then there's rotator cuff tear of quite a significant size, and she can't hold the arm up. And that finishes the shoulder examination. So to start the shoulder examination, I want Nicole facing the other way, and we're going to start with the neck examination, which is quite critical because a lot of the shoulder problems will have pain coming from the neck as well. And I just want to make sure that the patient is not suffering from cervical spondylosis or any severe neck issues that we haven't picked up in the past. So it always starts off with a look, feel, move situation. So looking wise, there's no spasm. We look at the spasm in the neck area. Then we start feeling, and we start feeling from top to bottom and see if there's any tender spot. If there's tender spot, we know that there's a problem in the neck. A lot of time the neck problems will go down, pain down to the rhomboid muscles and onto the trapezius. So it's always good to tap down there, and there, and there. And if those places are tender then and painful or spasmodic, you know that, well, there is significant contribution from the neck. And the last bit I'll do is to get the neck movement. Nicole, can I ask you to look down, please? And look up, please, to the right, and then to the left. And if you want, you could tilt the head onto either sides as well. Thank you very much. Nicole and I have decided to do a demonstration of how it actually takes just 1 minute to do a shoulder examination. So Nicole's got a stopwatch on her hand, and I'll show you how easy it is to get your idea of doing a shoulder examination completely within a minute and make a decision. There you go. Start that, please. Okay. Look down, please. Look up, please. Look to your left. Look to your right. Okay, straight ahead. Any pain there? No. Any pain there? No. Walking on the collarbone. Any tenderness there? No. Looking at the long head of biceps. Any pain there? No. Looking for external rotation. Now, that's good. Lifting the arm up. Doing the impingement test. Not bad. Hold your hand up there. Don't let me push down. That's not very weak. Excellent. Put your arm down. How much time did that take?
35 seconds.
That's even quicker. But if I explain as to what's going on, it would just be about a minute. You shouldn't take more than a minute. Thank you very much for watching. You've just seen the shoulder examination. So we went by with the neck. So if the neck is not an issue, the problem is with the shoulder. If it's the acromioclavicular joint, you know there's got impingement, could be a rotator cuff tear, or if it's a frozen shoulder because it could not externally rotate, and you've done the physiotherapy, you've done the anti-inflammatories, nothing has worked. Well, it's time for you to send the patient to me because you've got to take it to the next step. Please don't investigate anything beyond an X-ray. I will decide what needs to be done because if I'm going to intervene or not. Once you feel that the referral has to be done to me, you can approach me either by the hospital switchboard, and this is readily available on the website. You could directly get in touch with my secretary, again the details on the website, or you could do a referral letter directly to me and have it faxed across or emailed across to on the NHS email that the website has.